United Health Group CEO Andrew Witty is stepping down suddenly on Tuesday. I guess I could say I hope he's not dying or something, but short of that, in my view, fuck him, because he and his cohorts are responsible for the murder of who knows how many people, and the shortening lifespans of probably more. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. I am technically on parental leave after the birth of my incredible, beautiful son, River Chariton, but I needed to step in here because we have breaking news, and my wonderful rock star colleague, Ashley, who's been doing incredible work as our new reporter. She's currently en route to cover the horrific ICE detention center. She'll be on the ground in Newark, New Jersey. So I'm stepping in here to give you an update on a good day for the United Corporations of America. Andrew Witty, the vile vulture vampire CEO of United Health Group, which is the parent company of United Healthcare, is stepping down for personal reasons. Can't say I wish him well. United Health CEO leaves abruptly. Company pulls forecast, financial forecast, that is, as shares sink. Stephen Hemsley, who was the longtime CEO on another for-profit predator, he was the CEO for a long time. He'll be replacing Witty. United Health has been struggling, according to them, with higher medical costs. United Health has basically canceled its 2025 financial forecast, but expects to return to growth, they say, in 2026, and its shares have slid over 11%. On this news, United Health Group CEO Andrew Witty is stepping down suddenly on Tuesday as it has suspended its 2025 forecast due to surging medical costs, sending its shares plunging more than 11% in morning trading. Former CEO Stephen Hemsley, who has been with the healthcare conglomerate for 28 years, is returning to the top role after stepping down in 2017. Witty chose to leave for personal reasons, the company said. I don't know what his personal reasons are. I tend to be a good person, so, I guess I could say I hope he's not dying or something, but short of that, in my view, fuck him, because he and his cohorts are responsible for the murder of who knows how many people, and the shortening lifespans of probably more than they're acutely murdering. We're going to get to Mr. Witty's record here with United Health Group. Obviously, United Health has been in the news for the last 5 or 6 months after United Healthcare CEO Brian Thompson was gunned down, allegedly, by Luigi Manjon. The outcry from that has not actually been against Manjon, but against United Healthcare and the for-profit, predatory for-profit health insurance companies that are killing and mass amounts of people through their predatory denials of care. But if you never saw this, I want to show you, this is Andrew Witty, who just stepped down. This is him and his response after the death of, or the murder of, Brian Thompson. Listen to his words and tell me that this is not a predatory vampire of the worst degree. Let's take a listen as he paid tribute to Brian Thompson and waxed poetic about the important role that companies like United Healthcare play.
And there are very few people in the history of the U.S. healthcare industry who had a bigger positive effect on American healthcare than Brian. And we are going to make sure that we not only acknowledge and honor that legacy of Brian, but we'll continue it. Our role is a critical role, and we make sure that care is safe, appropriate, and is delivered when people need it. And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
So Mr. Witty, this brave warrior, guarded against. His integral role at the top of the ship of United Health was to guard against unnecessary care, meaning to deny millions. United Health is the biggest for-profit health insurance company in the United States, in the United Corporations of America. Get your United Corporations of America gear at the Status Coup store, statuscoup.com/store. I digress. His role was not to guard against unnecessary care, but to make necessary care unavailable to millions of human beings. That's what his role is. That is the system we have in a democracy. That is the system that we could talk about Trump, who's not going to change the system. Trump is awful. His little gimmick that he's cutting prescription drug costs. Yeah, we'll have to look at the fine print on that. But remember, Joe Biden was the president who said if Medicare for all was passed by Congress and came to my desk, I would veto it. The Democrats during the 2020 primary and 2016, they were the ones that said we can't pay for Medicare for all. And we have to protect the holy, sacred right of Americans to choose and have the choice of their United Healthcare for-profit private health insurance that they hoodwinked the masses, and the media hoodwinked the masses into thinking was actually good healthcare. It's not. It's killing people. These people like Andrew Witty are killing people. Let's go down the list of investigations, fraud committed by United Healthcare. Just under Witty, credit to the Wall Street Journal, who broke this story a couple months ago. The Department of Justice investigating Medicare billing practices at United Health, i.e. fraud. A civil probe, surprisingly under the Trump Department of Justice, was launched into the extra payments that United Healthcare was getting for its Medicare Advantage plans. The Justice Department has launched an investigation into United Health Group's Medicare billing practices in recent months. People familiar with the matter said the new civil fraud investigation examining the company's practices for recording diagnoses that trigger extra payments to its Medicare Advantage plans, including at physician groups the insurance giant owns, which is a giant conflict of interest and shouldn't be allowed anyway. A series of articles from Wall Street Journal last year showed that Medicare paid United Health billions of dollars for questionable diagnoses. Attorneys with the Justice Department, as recently as January 31st, interviewed medical providers named in the articles. Let me give you more details. Again, this was from the Wall Street Journal, so credit to them. Good reporting. United Health's army of doctors helped it collect billions more for Medicare, i.e. defraud Americans. But no one's going to go to jail for this, I promise. The biggest Medicare Advantage insurer presented physicians with checklists of potential diagnoses. I didn't think I was obese. Like most doctors, Nicholas Jones prefers to diagnose patients after examining them. When he worked for United Health Group, though, the company frequently prepared him a checklist of potential diagnoses before he ever laid eyes on them. United Health only did that with the Eugene, Oregon Family Physicians Medicare Advantage recipients, he said, and its software wouldn't let him move on to his next patient until he weighed in on each diagnosis. The diagnoses were often irrelevant or wrong, Jones said. United Health sometimes suggested a hormonal condition, secondary hyperaldosteronism, sorry if I'm mispronouncing, that was so obscure Jones had to turn to Google for help. I needed to look it up, the doctor said. The government's Medicare Advantage system, which uses private insurers to provide health benefits to seniors and disabled people, pay the companies based on how sick patients are to cover the higher costs of sick patients. Medicare calculates sickness scores from information supplied by doctors and submitted by the insurers. In the case of United Health, many of these doctors worked directly for United Health. No conflict of interest there, right? More diagnoses make for higher scores and larger payments. A Wall Street Journal analysis found sickness scores increase when patients move from traditional Medicare to Medicare Advantage, leading to billions of dollars in extra government payments to insurers. What we call that, folks, is fraud. Patients examined by doctors working for United Health, an industry pioneer in directly employing large numbers of physicians, had some of the biggest increases in sickness scores after moving from traditional Medicare to the company's plans. According to the journal's analysis of Medicare data between 2019 and 2022, sickness scores for those UnitedHealth patients increased 55% on average in their first year in the plans, the analysis showed. That increase was roughly equivalent to every patient getting newly diagnosed with HIV, the virus causing AIDS, and breast cancer. That far outpaced the 7% year-over-year rise in the sickness scores of patients who stayed in traditional Medicare. Across Medicare Advantage plans run by all insurers, including UnitedHealth, scores for newly enrolled patients rose by 30% that first year. Translated down, UnitedHealth was coming up with bullshit cockamamie sickness scores and diagnoses so that they could get more money from the federal government. And this is the system that the Democrats say people are clinging on for dear life to save, so they have a choice to keep their private health insurance. What choice do you have when you are literally being denied care by UnitedHealth, even though you are paying increasing costs every year for the right to have this for-profit health insurance that you are still denied care for? But it doesn't stop there. Under Witty, UnitedHealth, and under Brian Thompson, who was gunned down allegedly by Luigi Manjon, UnitedHealth uses faulty artificial intelligence to deny elderly patients medically necessary coverage, lawsuit claims. The families of two now deceased former beneficiaries of UnitedHealth have filed a lawsuit against the healthcare giant, alleging it knowingly used a faulty artificial intelligence algorithm to deny elderly patients coverage for extended care deemed necessary by their doctors. The lawsuit, filed last Tuesday in federal court in Minnesota, claims UnitedHealth illegally denied elderly patients care owed to them under Medicare Advantage plans by deploying an AI model known by the company to have a 90% error rate. Let me repeat, 90% error rate, overriding determinations made by the patients, physicians that the expenses were medically necessary. Is that what Andrew Witty was talking about when he said we guard against unnecessary care? Well, apparently to the tune of a 90% error rate. For those of you new to Status Coup, we have been on this for years, the for-profit predatory health insurance scam. But in recent months, since the murder of Brian Thompson and the obvious interest in the Luigi Manjon case, we have been covering this extensively. I want to show you this clip. This was from my on-the-ground coverage outside the courthouse a couple months ago, where supporters of Luigi Manjon appeared. I think this was a very powerful clip, not directly about Andrew Witty, but just about the predatory for-profit health scam in general. I want to show you this because I think it speaks volumes.
So I'm out here today because the top 1% who puppeteer these mega corporations and these for-profit health insurance scams are realizing that their days of acting with total impunity at the cost of human life are numbered. That is why they are charging Luigi Manjon with terrorism, because they are so afraid of people realizing what a scam for-profit health insurance in America really is. But I think that the veil has already been lifted. These corporations think that they can play God and pit everyday hardworking and honest Americans against one another who really all just want the same thing, an easier life. And they do this using petty conservative versus liberal politics, and really it's not about that. And I think that Americans are smart enough to realize that. I think that this case should not be called Luigi Manjon versus the people, because Luigi Manjon's alleged action actually stood up for the people. I believe that this case should really be called the people versus the people versus the for-profit health insurance scam, aka the most destructive and insulting and fatal thing ever brought onto innocent Americans in this country.
Think you're ever going to see that incredible, articulate woman on CNN quoted in the New York Times? A special on her, a documentary on her, or the activists and people out there? We've seen documentaries on Luigi Manjon depicting him and his supporters as, a cult and fangirls and all the rest. Not going to see much in terms of the actual murderers that are killing the masses. We want to show you one more clip here. This was again from the same rally, and you are making this happen. You, particularly Status Coup paying members, by supporting us for as low as $5 a month, you are making this happen. StatusCoup.com/join. Support us for as low as $5 a month so we could support that on the ground reporting. We recently hired Ashley. This costs money. We recently are using more freelance reporters. We're trying to hire a producer. It all costs a lot of money. And we don't have UnitedHealthcare or big corporations funding us. We are funded through you. Sign up if you can. StatusCoup.com/join. As low as $5 a month, 16 cents a day. One more clip I want to show you from that same rally, which again really spoke volumes of what this is really about, this fight.
Almost every single media person who's talked to me today has asked me, do I feel some sort of like moral, compromise from coming out to a murder trial? And to that I say, I'm not here for Luigi. I am taking it, the media is here, so I'm going to be here to talk to them about healthcare reform. And that appears to be what the initial murder was about. But you know what? They want us to protest peacefully. Then that's what I'm doing. You should actually report on that. Yeah, they've got blood on their own hands. So for them to be like coming out us and pointing their finger and saying like, oh, you support murder? I mean, look at your own news organizations. Like, look at who you get money from, okay? All these Congress people who are like, Congress people who are accusing us of being morally compromised. Where your stocks are in healthcare companies. You are voting against your constituents every single day for your own pockets.
Yeah, I mean, obviously there was the people online who were commenting on his obviously attractive appearance, but I mean, can we see him right now? Are we looking at him right now? There's photos of him on that shirt over there. I can pull those up on his phone. Why would I stand out in 22-degree weather if this wasn't something that I cared about? This is something that I feel very, very deeply passionate about, because this is something that has personally affected me, personally affected my loved ones. Basically, every single, you cannot talk to an American that has not had an experience or does not personally know someone that has not had a terrible experience with their health insurance industry. It's a running joke, and it shouldn't be.
I'm learning a little bit more about how the media is covering just large-scale events like this and the interests at hand. And I'm noticing a lot of media here today, thankfully not your channel, are going to the supporters and they're saying, do you support Luigi? And, oh, there's all these girls out here. Have you seen these headlines where they're like, there's a lot of women at these protests? And apparently we got another one of these headlines today, and there's actually people of all ages and genders here, just trying to fight for healthcare, and we're getting some kind of headlines that are just nonsensical.
Just trying to fight for healthcare. One of the monsters in the United Corporations of America is now fallen. He will quickly be replaced by another monster, and we will continue to try and slay said monsters.